So measles is a viral illness, one that's been around for a long time. It infects humans very easily. In fact, it's one of the most contagious viruses we know of. So contagious, in fact, that in close contact with people that are susceptible, if you put 10 people in a room with someone with measles, 9 of them are going to catch it. So it's very contagious. It's also airborne, which means it can linger in the air for long periods of time. Even after someone's left the room, it can be contagious off of the air or off of surfaces for up to 2 hours, even afterwards. So because of that, it's extremely contagious, very easy to catch if you're around someone who has it, and you are susceptible. So susceptibility means that you've either not had measles before or you've not been vaccinated. And you know, to this country, since 1963, when we really started with a measles vaccine, we've had fewer and fewer cases. In fact, in 2000, the United States was considered measles-free because there were no continuous spread of cases within the country. That's changing a little bit now. Now with people that you know, are resistant to vaccination, don't believe in vaccination, and with large influxes of populations that are unvaccinated because it's not available as easily in all places of the world as it is in this country, we're seeing more and more cases as we're experiencing right now. So we'll see outbreaks. Now, outbreaks have happened in the past, but as long as the population is largely 95% vaccinated, it really doesn't spread. In fact, even if you're not vaccinated, your risk of catching measles is very low because 95% of the people around you are vaccinated and they're not going to transmit it to you. So that's the condition we'd like to be in. However, because fewer and fewer are getting vaccinated, that number is dropping in this country. So it makes us more susceptible. We don't have what's called herd immunity from having lots of people that are immune to it around us, which makes us all susceptible if we're not getting vaccinated.
Man, herd immunity, haven't heard that one since COVID, but makes sense. So tell me a little bit about the MMR vaccine and how it protects our bodies against this virus.
Well, measles, mumps, rubella vaccine is a combination vaccine. It includes the one that's been around since 1963. That's the measles component of it. It introduces basically a dead viral type particle. It's part of the virus, some protein that acts as an antigen in your body. So your body builds up then antibodies against the virus. So when you're exposed, your body has the ability to react through its immune system and prevent it from spreading and causing symptoms. Measles is a little tricky because you don't necessarily show symptoms of it for 7 to 14 days after you've been exposed, but you can be contagious before you start getting symptoms. So symptoms initially are high fever, red eyes, cough, congestion, runny nose. You get these little tiny spots in your mouth called Koplik spots. They're inside your cheeks that you get, particularly with measles. You don't get it with other things. But then you stay contagious, including throughout the period of your rash, which starts at your face and spreads through your whole body. Even after the rash is gone, you're still contagious for several days after that. So even if you're not showing signs and symptoms, you can be spreading it to other people on either end, either the beginning or the end. So it makes it pretty difficult when you're looking at large populations potentially, or people moving through airports, people moving through bus stations, local gatherings in schools or churches. If somebody has measles and you're not vaccinated, you don't even know you're being exposed, potentially, because they don't know they have it either.
So hypothetically, let's say you do know that you've been exposed. What should you do in that case?
One is not be out in public. Is call your healthcare provider, call your doctor. They will recommend testing for you to determine whether or not you're going to catch it. Now, your odds of catching it are almost zero if you've been vaccinated. Not exactly zero, but pretty close. If you're not vaccinated, then that's something you need to be concerned about. And so calling your healthcare provider, calling your doctor, talk to them about the fact that you believe you've been exposed, and they'll make recommendations in coordination with the state and local health departments about getting you tested, telling you how to confine yourself so that you don't really potentially spread it if you do start coming down with symptoms again, because you're potentially contagious before you have symptoms, and they'll help recommend your care at that point. Unfortunately, there's not really good treatment for measles, right? And so it's a viral illness, and there's no antiviral medications we know really work. Vitamin A may help in some instances if you've had exposure to measles and have active disease, but we largely treat the symptoms. So patients get bad pneumonias, they can have blindness, they can actually have brain infections from it, inflammation, it's called encephalitis. So it can be pretty severe. Mortality's pretty low. Still not as low as you'd like it. You know, in normal populations now it's about 0.3% mortality rate, somewhere around there. Prior to the vaccine, the mortality rate was thought to be as high as 5% of people would die from it. So that's higher than we had with COVID. In fact, this disease is more transmissible, more easy to catch than COVID, and it's easier to catch than flu. So.
Wow. When is it recommended to get those vaccinations?
They're childhood vaccines that we give in the first few months of life, and we give it twice. So, and the MMR is a combination vaccine, measles, mumps, and rubella, prevents all three of those diseases. So.
And if you only get one round of vaccination, how much does that protect you?
I don't know that number off the top of my head, but it's not as much as you'd like. So get two.
So that would be the typical recommendation,
That
is
is.
to get both rounds.
Right, correct.
Okay. If someone is feeling the symptoms, other than going to your primary care physician, what are some of the best things, maybe some home remedies that you can do to make yourself feel better?
Well, remember, you're going to have a high fever, so Tylenol is a big important component of that to help manage your fever. Get plenty of hydration. Watch for symptoms of pneumonia, which would be severe cough and productive cough, shortness of breath. Watch for confusion, which would be a sign potentially of brain infection or brain encephalitis. And other than that, it's largely over-the-counter medications. So some cough medication, something for your sore throat. You're treating the symptoms, really.
Are there certain demographics that are more at risk of those more severe symptoms?
Youngest age population, particularly children under the age of 5, people that have immune suppressive type diseases or on, say, chemotherapy, so their immune system's impaired. They're extremes of age. They're very young, they're very old, are the most susceptible to getting pneumonia and some of these symptoms. But it particularly looks like mortality is highest in the age group of under 5 years old.
And we know there are cases in Texas, and there was recently mortality, a
Yes.
death reported. So what does the protection look like here in East Texas, and how on their guard should people in this area be?
Well, if you're immunized, you really are safe. It's really difficult to catch at that point. For certain populations around here, and I'm sure there are local groups that potentially aren't vaccinated, and particularly if they're traveling, really the risk is unknown at this point because it is spreading from West Texas. Obviously, we've had a more local case. We've had a mortality because of it. We'll have to see. It's something that I'm sure that the CDC is watching very closely. Our health departments are watching very closely. We are testing patients here at the hospital that have come in concerned they may have it, but we don't have any identified cases at this point. So.
What does your concern look like in terms of this most recent outbreak and its potential to spread?
Theoretically, it shouldn't spread far. And again, because large parts of the population, and particularly school-age children, have already been vaccinated. But it has potential to spread to small communities. It has a chance to spread, probably not worldwide or across the country or anything like COVID did. It'll be a local spread, probably.